Hi, everyone, and thank you for joining us for tonight's Building a Better Business, the importance of including TCM into birth during the current pandemic. So I see a couple of you have joined us tonight, and that is so exciting. I hope all of you are doing well. And tonight we have expert Deb Davies, an expert in natural birth and childbirth educator. So this webinar is brought to you by FSOMA, the Florida State Oriental Medical Association. And this is part of our Building Better Business Practice Management web series. Thank you everyone for joining us. My name is Natalia Morrison, and I'm the Director of Communications for FSOMA. And before we start with Deb, I wanted to show you guys at the bottom of your screen, there is a chat box. So why don't you all type in the city that you're located in so we can get to know where you're from. So I am in Miami, Florida. And Deb, you want to share with us where you're from, where you are?
I am in San Diego, California.
Nice, San Diego. Oh, we have Sophie, who's also in San Diego, Marilyn, also in San Diego, and Madeline in Jacksonville. That's great. Sarah in Lake Worth. Wonderful. Thank you, ladies, for joining us tonight. So we're going to hold the Q&A towards the end of the presentation, but there's also the Q&A icon at the bottom of your screen, and you can tap, I believe it's there. Hold on. So I'm not seeing it, and I apologize, I thought it was there. So type in your questions in the chat box, and we'll make sure to go over them at the end of the presentation. So without further ado, Deb, welcome and thank you for joining us.
Thank you so much for having me. I'm gonna just take a moment and share my screen and get my PowerPoint up here so everyone can see. One second. Oh wait, what I just did. Okay, so this is my topic here, the importance of including traditional Chinese medicine in birth, even during a pandemic. So I wanted to start to share a little bit about me because I realize I'm a new presenter and I certainly don't know a lot of the people in Florida, but I love what I do and I do what I love. So I'm just gonna share my background a little bit. So I began in the acupuncture field in 1996. I worked with an acupuncturist in the suburbs of Philadelphia, who's actually a Florida acupuncturist now, Kathy Goldstein. And that was my beginning of acupuncture world. I was so impressed and amazed what this woman could do and how she helped so many people that she really was a huge inspiration for me starting along this path. So I moved from the East Coast to the West Coast, where I was originally from, and I began massage school in 1999. And then I got married and I started having babies. So in 2001, I had my first baby. And unfortunately, my baby was stillborn. I had a stillborn at term. She died at 40 weeks on her due date, and it was because of a cord accident. So even though, you know, that was really the worst thing that ever happened to me, it has transition into the best thing, which is my career. And with all my heart and soul, I love helping women and I love providing natural options in healthcare, especially around pregnancy, birth, and postpartum. So I did go on to have another successful pregnancy. I have an 18-year-old daughter now who's going off to college next year. So I did attend PCOM in San Diego, and I joked around that I was on the 100-year plan because it took me 7 years to finish, but I did it. And during that time, I was a massage therapist, and I had my first doula client. One of my massage patients said, "Hey, Deb, will you be my doula?" And I had been massaging her all throughout her pregnancy. So I was like, why not? I could do this. And it wasn't until several years later in 2013 that I actually took a doula training through a company called DONA, which is Doulas of North America. I chose them because I thought they were the best with the highest standards and whatnot. But then after I took the course, I read all the books, I attended the births, I wrote the reports, and I was reading all of the little intricacies of what needed to be done for getting certified. And one of the things it said is, if you're serving as a DONA doula and you have a medical license, you will not use your medical license while serving as a DONA doula. So for me, that didn't make any sense because everyone hires me because I'm an acupuncturist. So I did not certify with DONA, and it's kind of been in the back of my mind that I really want to create like an acu-doula program for doulas and other acupuncturists. So I have gone on to create some classes. I am a CEU provider for NCCOM, for California, as well as NCBTMB. I'm also a childbirth educator. I certified with hypnobirthing several years ago and began teaching courses to the public on childbirth education. And I just loved it so much. I started my doctorate many years ago, and I'm going to finish after this term. Woohoo! So I'm very excited about that. And currently in private practice pre-pandemic in San Diego, and also a professor at Yosan University in Los Angeles in their doctoral program teaching women's health. So these are my mentors. I love Bertram Furman. He is an acupuncturist based in San Diego, and he mentored me all throughout my PCOM experience and beyond. He studied with Dr. Yitan Ni, so he taught me a lot of her things, especially related to women's health stuff. Robin Tabiri was one of my first teachers at PCOM back in the day, and she taught me women's health, so she helped shape a lot of my thoughts and feelings today, as well as God bless Giovanni. Deborah Betts, her book on pregnancy and birth is amazing. It's pretty much my Bible. And then Jill Blakeway is amazing, as well as I really can attribute a lot of this to my own babies that I've had, as well as the hundreds of families that I've worked with, supporting them in their labors and births specifically. So what we're going to talk about today, these are our topics. So we're going to talk about what is birth, what does that mean? We'll talk about what's the difference between birthing in a hospital, a birth center, and home, and the pros and cons of each. We'll go through a little bit of the statistics of birth, and we're going to talk about how Chinese medicine can be incorporated into birth, and then what's going on with the pandemic in birth. And then we'll open it up for Q&A in the end. And I'm really happy to answer all your questions. It's a lot of information and a little bit of time, but I'm going to do the best I can to give it to you all. So I have questions for you guys. And so I'm always interested who's taking my class, like who's birthed their own babies? How many of you have given birth to your own babies? Who's been to a birth or attended a birth? And then if you did attend a birth, were you an acupuncturist? Did you do massage? Were you a doula? Were you just a family member? You can go ahead and just put it in the chat, and we can just kind of get to know you guys a little bit more. But that kind of helps me see who's here and what your perspective is. So what is birth, and what is natural childbirth especially? So birth is a normal, natural process. And as acupuncturists, we know that we want to mirror nature as much as possible. And if you look at any mammal in nature giving birth, you see a couple of things. One is the mammal's typically alone or with one other mammal. It's a very intimate thing. And all they do is that mammal's moving and changing positions and moving here and moving there to get comfortable throughout their labor. So it does not have to be a medicalized event, birth. And for thousands of years, women have been giving birth where the baby was conceived at home in bed. And it's only been since the 1900s that really a lot has changed with the American Medical Association and birthing in hospitals, that kind of stuff. But one of my big goals is really to educate and empower women to be prepared and to take responsibility for your birth, because it doesn't have to be how the media portrays it, like it's a scream fest or whatever. Really, it can be so, so incredibly beautiful. And it often is. This picture was taken at a home birth that I attended as a doula, AcuDoula, and it was pretty much right after the baby came out. And it's just beautiful to see these pictures. All of these pictures I've been given permission to use this for teaching purposes, and mostly with my clients that I've given birth with. So in terms of where do you give birth? So there's basically 3 options in the United States, and it's in the hospital, it's in the birth center, or it's at home, or it's on the way to one of those. And if it happens on the way to one of those, it's typically okay because it's a normal, natural birth. It's just happening. And if it happens quickly, it's usually because the mom and the baby are so healthy that the baby just needed to be born. And so just keep driving to the hospital and they'll take care of you when you get there. So next we'll go through some of the pros and cons of each of the different places to give birth. So in my world, I believe home birth is the best place you could give birth. It's very intimate. Typically the women are so happy with the birth outcome that they're just thrilled in the end. So I think that it is nice birthing at home because the only people who show up are people who you invite. Your family, your doula, your acupuncturist, your mother, your mother-in-law, whoever it is. So in the hospital settings, it's usually quite different where there's a lot of strangers and the staff that you don't know. So I use this in quotes allowed to eat and drink all you want, because in the hospitals, they don't allow you to eat and drink when you're in labor. There's a lot less chance of interventions happening at home because there's really not much available to you at home. You get to rest and recover in your own bed. And typically the moms, the partners, and their babies are so happy with the home birth that it's just increases that satisfaction so very much. I realize not a large percent of women are birthing at home, but it's an interesting shift with the pandemic that people are now really interested in midwives and giving birth at home. And midwives care for normal, healthy women having normal, healthy babies. And in 80% of the world, there are 80% midwives taking care of those normal, healthy women. But for some reason, in the United States, it's kind of flipped, and there's 80% OBGYNs. So the doctors are always looking for problems. And yeah, so I always feel like it's really important to share about midwives and what midwives can do. So I see a woman, I am past my childbearing ages, but I see a midwife for my well woman care because I feel like I have a better experience than going to the doctor when I need to go. Okay, so some of the cons of home birth. One is that it's perceived as unsafe by society. So I think that's just a perception, because now it's interesting, you know, how safe is the hospital, especially if you don't want to get this horrible disease, you know? So I feel like our thoughts are changing on that as we go through what's happening as well. But there is, some people just feel like, no, it's not safe. And I believe it is safe. Midwives go through extensive trainings. And when that birth comes, there's typically 2 midwives there because one's caring for the mom and one's caring for the baby. So one of the other concerns with home birth is that it's not covered by most insurance. So there's a fear or a concern of how much money will you spend. And then if you were to have to transfer to the hospital, and now you're spending even more money. But something worth noting here is that you don't know what your hospital bill is going to be until 6 to 8 weeks after you give birth. So you get a bill, you know, from the hospital, from your OBGYN, if you get an epidural, from the anesthesiologist. You're also getting a bill from the pediatrician. Now that child is a new dependent, so it's like if you have a $5,000 deductible, you got to pay that right away. So oftentimes people aren't aware of all the costs associated. So it is worth looking into. In the state of California, home births typically cost anywhere from $3,500 to about $6,500. And that's everything. That's prenatal care, the birth, and your postpartum. So a birth center, I would consider as middle ground. It's not at home, it's a medical facility, so you're leaving your house to go. Same kind of pros, there's very low chance of interventions, and you have all that freedom of movement and eating. At this point in time, I believe that even the birth centers, as well as the hospitals, are only allowing one support person. So that's a big change for a lot of people that were planning to bring their doula. So us doulas are learning how to do virtual births and different things like that. So there's a lot of pros with birth centers. This was a beautiful birth. This is the last birth I attended. She was able to have an all-natural birth in the water, which is kind of like a dream for most people. So one of the cons of a birth center, though, is that you can only be there a maximum of 24 hours. So 24 hours isn't a long time in labor. So they really want to make sure you're 6 to 8 centimeters, that you're really in active labor before they would admit you, because then they want you there for the labor, for the birth, and then at least 4 hours postpartum, and then you can go home. So some of the cons with birth centers, again, could be related to costs, lack of insurance coverage, and then again, if you were to have to drive to the birth center and that didn't work out and then you transfer to the hospital, it's even more money. That's reality. So now we'll get into hospital choices. So pros is that it is a perceived safe and life-saving measures. And I do believe, if I get into a car accident, I'm going to go to the hospital. I'm not going to run to my chiropractor right away. Like, I think that there are a lot of great things about hospitals, but it's interesting, the safeness, especially now in the time of the pandemic. How safe do you feel walking into the hospital right now? So again, times are changing. It is covered by most insurances. That is typically where most women give birth, in the hospital. So the cons are the interventions, and that's something I will get into a little bit as well. I don't know if you guys have seen the movie The Business of Being Born. It's a documentary by Ricki Lake. She put it out several years ago. It's being offered for free right now, and it's a great documentary to watch because it tells you the reality of what's happening out there in the world, and this will give you a lot of great information just to have a better understanding. So again, a con of risk of potential infection or disease exposure at the hospital. For a lot of people, one of the biggest cons is that they don't know the staff. It's all these people in and out every 12 hours. They're changing staff. So it's, it's frustrating. And then there's timelines with the hospitals. So they have specific policies and procedures. If your bag of waters breaks, you must give birth within X number of hours. And some hospitals it's 24, some it's 48, some it's 72. So it's very different. And that can be a concern, because if you're in labor and your bag of water breaks and you go beyond that, they're going to want to C-sect you. So that can be concerning for a lot of people. So I pulled this stat, and in the United States, it's an average of about 23-24% induction. So many people are being induced these days. And the concern is the cascade of events that accompany inductions. So they will induce somebody, and then they'll start with the Cytotec or the Misoprostol or Pitocin, and then maybe their heart rate drops or their blood pressure drops, and then they need meds for that. And then they are in too much pain, so they get an epidural, and then they're confined to the bed, and it's kind of like, and so on, and then at some point, oh, it's taken too long, we need to C-sect you. So that's really the concern. And when you look at these rates of inductions, how they've exponentially exploded, like doubling it was from 1990 to 2010, doubling those rates. So this was taken from the Cytotec website, which is one of the agents that they typically use to induce women. This is a starting point. This is before they would add Pitocin. So they would put this pill up inside a woman's vagina and put it right next to her cervix. Now, I'll give you a minute to read the slide because I think it's worth reading. So I looked for the same thing today, and I couldn't find it exactly, but it's all about how this should not be taken by pregnant women. It could cause a preterm labor or a miscarriage or a loss. And this is a drug designed for digestive disorders. So it's concerning that every single woman just about is getting this. And people are like, induction, okay, great, I'm going to have my baby today. Like, just completely unaware. So a reason why you might want to know this and share with your patients, there's something called a Foley bulb. It is a device that they would insert inside the woman's vagina into her cervix, and she has to be at least 1 centimeter dilated, but then they would just pump it up every so often to open a little more, and once it gets to 3 or 4, it just comes out, and she's typically in labor. So here I'm going to share a story with you. This was a beautiful couple I worked with, and this woman was determined to have an all-natural birth. She was 42 years old, and this is her first pregnancy. And she was high risk for a number of factors. One being she had a bicornuate uterus, which means her uterus was in 2 halves. So she found this amazing physician, and in San Diego, there's really 3 doctors that are just stellar. They're just amazing. They commit to delivering their patients no matter what. So they're always on call 24/7. I don't know how their wives put up with them, but this was one of those doctors. She got so lucky, and she tried to switch later in pregnancy, which was a challenge for her. And so she actually went to this guy's office and brought him food, because initially they were not going to take him, but she was so lucky she got in. He's Greek, she's Greek, she used her Greek card. It worked. So anyway, she's in labor. She's about 8 centimeters, and she just wouldn't progress for hours, just 8 centimeters, and that was it. So the doctor says, okay, well, I think we need a little help here getting things going. And her contractions started petering out, and he talked about Pitocin, and she's like, oh, no, I don't want to be induced. No induction, please. So she's like, Deb, what can you do? So what I did was something called kidney chafing. And I feel like a lot of us learn this in 2E class. You hold kidney 1 with one hand, and then you go kidney 2 to kidney 7, warming. And you're using your intention, you're putting that yang qi into the body and up the kidney channel, and then boom, there's a contraction. It's amazing. It works every single time, and every hospital situation when those contractions stop. So I was doing this, and then she would push. He actually had her start pushing at 8 centimeters, and he helped by using his fingers to get her body to actually open up big enough to let the baby out. And at one point, it was so interesting, I hear a pop. So I think that chamber separated or opened to allow the baby to come out. So kidney channel chafing is like your natural Pitocin, which is wonderful for acupuncturists to know this kind of stuff. So other potential interventions is the intermittent or continuous fetal monitoring. So these women here, she has the monitor over her. She's hooked up to the tachometer. So there's 2 straps. One's measuring the baby's heart rate. One's measuring how often she's having contractions. So it's frustrating for women that are birthing naturally, especially, to be confined to a bed. So we go back to mammals birthing in nature, they just need freedom of movement. So this is often very distressing for women. So oftentimes it's 20 minutes of every hour that you must be fetal monitored. So you'll walk around, you'll do your squats, you'll get in the shower, the bath, whatever, and then 20 minutes of every hour you're back in bed being monitored. If for some reason, like your bag of water broke and there was meconium where the baby had its first bowel movement, then you might be continuously monitored, because that's a higher risk situation and they want to keep an eye on that. All hospitals require IVs, or at minimum a HEP lock, which means they put the IV in and then they remove the needle, but they leave the plastic tubing in there so they have access in case there's a problem. So that's something that's common. If you do get an epidural, a lot of times people aren't aware that you're going to have a blood pressure cuff and a pulse ox, or they're going to put compression socks on you. They have a catheter in you. There's so many wires and connections with all of these interventions. Women are more likely to receive pain medication. My very first birth that I attended as a doula, the woman said, I want to give birth naturally. And so every 30 minutes, the doctors or the nurses came in and said, are you ready for your epidural? Are you ready for your epidural? And they kept doing it over and over until at one point they said, oh, the doctor's going to go back for a C-section. He's going to be gone for a while. You might as well get it. She got it, and she was so disappointed at herself. And like, still to this day, 14 years later, she's still talking about it. So it's really, it really can be frustrating when they're pushing the drugs kind of thing. So sadly, there are things happening such as no explanations. Procedures are being done without being given explanations. And some women are coming out of birth feeling traumatized, feel like they were raped, something just horrible happened. And I see these women over and over and over. So it's sad to see. And, you know, it's a fine line of doing that dance of like protecting them from the hospital interventions and educating them on what's possible where. Another thing that's common is they'll do an internal fetal scalp monitor where they actually put kind of like a needle into their head and they're monitoring their heart rate from that. I had a patient recently have that, and for 3 months after that baby came out, it had infection after infection. It wound up being on antibiotics several times and got a staph infection, was readmitted to the hospital twice after that. So sometimes they can be great, but sometimes they can also cause problems. So just people being aware. I mentioned the catheter before. The amniotomy is an artificial rupture of membranes. So that's where they take a hook, like a knitting hook, stick it up inside the vagina and snag the bag, and it will rupture the membranes, possibly speeding it up. Augmentation is a Pitocin Misoprostol. This is a picture of forceps. They actually use these to deliver like salad tongs and pull. So you can imagine, I had this in both of my births, and my pelvic floor has never really been the same. So I get that sometimes this is necessary, but it can cause lifelong problems. Episiotomy is a cut in the vagina. So when I first learned about this, I thought it was just a snip. But I've seen doctors cut 15 times. And for the first time ever in the history of the United States, a woman last year from Los Angeles, there was a mother in the room videoing her daughter giving birth, and this doctor was telling her she needs an episiotomy, and she didn't want it. And she was like, no, and why? It's actually on YouTube. I figured I'd spare you the gory details to see this. But he cut her against her will, and it was on tape, and he lost his license because of obstetric violence. Obstetric violence is sadly a real term, and it's something that is happening out there. So that is such a concern for women, and I've heard numerous stories of different things. So I think a lot of times people just don't talk about birth, and they're like, oh, don't tell her what could happen, don't want to talk about what did happen. And I think that women's mental health is really important. So my thought in wanting to share this is that if I can help you help someone, another woman, not go through that, that's really my goal here. So some of the other hospital things is that you're not allowed to eat or drink in the hospital, and pregnancy is treated as a disease. There's the timelines I mentioned with the policies and procedures, including the potential for obstetric violence. I thought this was a funny picture because it looks like they're putting this doctor in that lithotomy position, which is on their back, which is the worst position to give birth, because with a pelvis, you gotta like, your sacrum is kind of hooked up, so you got to push the baby out and up when you're on your back like this. So I thought it was a funny picture just to show how silly it was. So now I want to tell you about a story of Megan. Megan is having her second baby here. I was with her for her first and her second. Oftentimes I have interns that come in with me to the class or to the labors that I'm teaching how to be an acudoula. And so I had said to this woman intern here, I said, look, you be the acupuncturist, I'm going to be the doula in this situation. So right now she's about 8 centimeters. She's in the tub. She was enjoying it as much as she could. She was vocalizing, making a lot of noise. And after she got out of the tub, she was very uncomfortable. And so I looked at my intern and I said, do the bileal point. And in my experience as the acudoula, I would maybe get 2 points in before I had to kind of run back and be in her face and say, you know, breathe for the next contraction. So I turn around and she put all 8 bileal points in. And this woman gave birth about 20 minutes later. It was amazing. It was so fast. So when you're at a birth and that she's at that point where she can't take it anymore, do one or two of the Piley points, and it usually comes a lot quicker. So in terms of making choices, I always advise people to tour the hospitals, tour the birth centers, meet the midwives, interview the doctors, and see. And you can even do this before you're pregnant. Every pregnancy is about 280 days. So it's actually 10 months, not 9 months like we think. So in most cases, you're going to hit that open enrollment time. So if you find that you should be at a different hospital, that's always a nice time to change. You can change birthing facilities, you can change doctors, you can change from a doctor to a midwife. It's okay. I've even had people change as late as 38 weeks, give birth in week 39, and be so glad they made the change. So just looking into the policies and procedures of the facilities, and you can also check out statistics of facilities, including C-section rate, induction rate of each hospital, as well as the doctor themselves. And lastly here, hire a doula. I am such a pro-doula person, and I think not having a doula at your birth is like not having flowers at your wedding. You absolutely 100% want to have a doula, and if you can find an acu-doula, even better. You know, and find somebody you love, because some people want that grandma energy at their birth, or some people want a best friend. So every doula should interview, or let them interview you for free, because it's got to be a win-win on both sides. And one of my goals is really to help educate acupuncturists become doulas, to be confident in labor and birth, because there's no other program out there like that teaching us that and working with us. So these are C-section statistics. And I was born in the 1970s, where the United States had about a 7 to 10% C-section rate. And currently, to date, our C-section rate is about 32%. So that is saying that 1 in 3 women are having major abdominal surgery. So that's a concern, because of many reasons, but one of the reasons is, especially if this is a second or third baby, now you have a toddler at home, you have a newborn, you have a major incision in your belly, and you're not allowed to lift anything over 10 pounds. And I feel like the postpartum depression is enormous in the C-section population. So this is just something that I've noticed and seen a lot of. This is a story of Angie. Angie is a 25-year-old woman having her first baby. She has absolutely no risk factors, perfectly healthy pregnancy, and up to this point in her labor. She's about 8 centimeters here. Her husband was beautiful, helping her. So she's, like I said, about 8 or 9 centimeters, and the heart rate started dropping a little bit on the baby when she was having contractions. And the nurses all rush in and everything. Everyone's like, okay. And then every birth I've ever been at, there is a drop, a decel in the heart rate. It's just normal. It seems to happen all the time. So it happened twice, and they started talking C-section. Oh, we're going to C-section her. Blah, blah, blah. So I know that if I tap on bladder 67 with my little pinky finger, or, you know, dig my little fingernail in there, that's going to pop that baby's heart rate up. And it does it every single time. So I put little ear seeds on UV67. I showed her husband and her mom, everyone who was in the room. So whoever was near her butt when she would contract, we're pushing those points. So it didn't happen. She was able to have a natural vaginal delivery and no C-section. She wanted to have 4 kids, so it was important that she not. Another concern is the maternal mortality rate in the United States. We have the highest maternal mortality rate of all of the developing nations. It is a very big concern, and I think there is a correlation with interventions and high medical technologies and these numbers. So it's definitely something to look into and be aware of. The other thing I think it's important, worth mentioning, is racism in pregnancy and birth. It exists. Sadly, it's there. There's a woman named Sabia Wade. She started a company called Black Doulas, and it's incredible how much we need to support our women of color and be aware of this. I could talk in great lengths on this topic, so I just put it in here just so you're aware of it. If you're supporting diverse populations, it's just something to be aware of and know about. This is a story about, I am doing my doctorate, and I was in the internship part. So we have to intern somewhere. So I chose to work at a birth center. I put half my hours on for clinical, and then I said, put me on call. Call me if you need me. I want the midwives to understand how much we could help. So I get a call 5 a.m. one day, ring, ring, we need you, Deb. So I rush over there, and they say, okay, first time mom, she's 8 centimeters, her baby's OP. It means occiput posterior. Some people know that as sunny side up. The baby's in the wrong position. And so what I did is I do this protocol, and it's UB 60, 67, and spleen 6. I put my ear seeds on all the points, and I tell all the family members, and I said, look, so the woman's side lying like this, the husband has these points. I said, I'm going to rock her butt. Hip rocking. Very, very easy. Just side to side. You see her like undulating, toes to nose. And within 4 or 5 contractions, that baby turned, and she got in the tub to give birth. Thank you. And I went back home. So it's just another example of how easy it is to make these little changes here. So now we're into the pandemic in birth, and there's concerns of the different birth locations. So as far as I know, all of the birth centers and hospitals are only allowing 1 support person. So that means doulas are virtual doulas, and we're not able to go and do acupuncture in labor like I normally would just come in to, so I can do acu-doula where they hire me as a doula and I'm on call, or I'll go in and I'll just facilitate a change for an hour or so. And I can't do that now unless it's at their home. There's a lot of fear around the birth and the pandemic and the concern of the birthing. So I really want to not spread the fear, but encourage the women to talk to their providers about their concerns. You know, make sure they feel safe and supported. And you don't want to have the lack of trust. You know, we're not allowed to have as many support people. So you have a husband in there or a partner that they might not know anything about birth, and it's their baby too. So it's hard. So things are different. The women are wearing masks, even in labor. That's so hard. I can't work out with a mask on. I'm trying, but I can't imagine being in labor with a mask. And now the rules here are that support person, whoever comes in, stays for the entire labor, the birth, and the postpartum. There's no in and out privileges. You don't get to go home and take a shower. If I stay at the birth of the doula, the husband doesn't get to switch out. So it's kind of frustrating, but that's the way it is, and that's what we're kind of dealing with. A lot of women are saying, should I change providers? Should I go from the hospital to the birth center? And I would encourage you to do research, and it depends on how far along you are, what your health status is, and so forth. So I want everyone to feel safe, but to know, like, if you're early in your pregnancy and this is a concern and you're having an easy, uncomplicated, no problems with you or baby, it might be something worth considering. And maybe your partner didn't want that, but now in the pandemic, it might be open for discussion. So what can the pregnant women do to stay safe? I'm going to say the same thing as all of us. Wear your mask, stay home, 6 feet apart, wash your hands as often as possible. I'm not treating women right now. My clinic is closed since this happened. And you could go to their home. That might be a safer option for people, especially if they're really in need. Unfortunately, we're not really able to go to the birth facilities like we used to. So one of the things I'm doing is telehealth. And in my telehealth, meetings, I'm going over what's going on, and then I'm teaching them acupressure. I might send them handouts or point them to YouTube videos, things like that, to learn how to do moxibustion to help with X, Y, or Z. And then I love earseeds.com. They have all these earseed kits. They have a fertility kit. They have a postpartum kit. They have a back pain kit. They have all stress. So it's great because you can just say, boom, get this. And that's really nice to have. And then educating people. The birth education is so important. So I feel like that talk time with people is one of the most important things you can do, is spend the time educating, empowering the women to feel better and safer in their pregnancies. So I'm going to end with Angie's story. This was an interracial couple I worked with. Angie was a second-time mom, and she had a horrible first birth experience. She had every single intervention minus the C-section, and she was she was traumatized and she was really, really scared to give birth again. And she was planning to give birth in a hospital because that's what her insurance covered. And so I treated her all through her pregnancy, her labor, and her birth. And it was beautiful because she was able to have an all-natural, unmedicated vaginal birth with my help. And so I just want to encourage you and share with you how helpful Chinese medicine can be in so many and so basic ways. It's just mind-blowing. So that is my presentation, and I would love to open it up for questions, see if anybody has any questions. I have handouts on my website, on the Push San Diego website under resources. I have a myriad of pregnancy and postpartum handouts. So I would often give that if there's a baby's OP, like I had said, the sunny side up baby, or if the baby's breech, or natural promotional labor, even labor prep things. So I have a lot of great information. Please feel free to take advantage of it, share it. I also have a YouTube channel, and I teach people moxibustion and all sorts of different tips there. So thank you so much for your time today. It's really an honor to serve, and my whole goal is to educate and empower expectant couples to have safe and healthy pregnancies, births, and recoveries by offering natural options in healthcare. Thank you.
Thank you, Deb. That was amazing presentation. Thank you for sharing everything that you have with us. So we are opening up to questions. Please, ladies, this is your time. Take advantage. So we do have one question that came in. What is your favorite protocol for overdue mamas?
My favorite protocol for overdue mamas, and this is one of the number one things I see in my clinic over and over and over again, is really, it's not even the point so much. It's something called moxosacral fan. And I learned this from Heather Bruce in Australia. And if you put your hand over a sacrum, so say this is the lateral border, this is the lateral border, and then this is the spine, you're basically doing 5 lines, and you're moxing their sacrum all the way down to their butt crack. And you want to make sure that their sacrum is nice and warm. And so the way that Heather taught me was you should do it every single day, 30 days prior to giving birth. And you would do 1 to 3 minutes a day. And I didn't catch that initially. And a lot of my patients I see once a week. So I would moxa them 10 minutes, 15 minutes while they're in my clinic with the needles, blah, blah, blah. So I had an intern at the time. I learned this, and she said, well, practice on me. Let's see it. She was planning an unmedicated natural birth. And so I saw her about 3 weeks in a row, and I did this treatment. And when she went into labor, she wound up giving birth in 40 minutes after she arrived to the birth center. So I think that is one of my favorite things, really. And so on the women that I work with a lot and that do that moxosacral fan are having incredible results with having quicker, easier labors too. So that would be my favorite thing. But typically I'm going to have them on the side. I'm going to do the ear points, and I work my way down the body with the points. So I'm going to do Shen Men, point 0, endocrine, uterus, maybe kidney or liver. And then I might just kind of, a lot of times people are very livery. They're like stressing out, frustrated, freaked out about everything. So I end up doing a lot of liver gallbladder points, typically, if that's indicated. So I'll do gallbladder 21. I might do some bileal points, and then just kind of work my way down the body.
Wonderful. Thank you so much.
Sure.
And another question. Can you explain again when you use the bileal points during labor?
Yes. So the bileal points are the sacral foramen points. So there's 8 holes in the sacrum. And so I feel like I've mastered this, and this is something that you guys could start playing with. So I do labor prep earlier in the pregnancy. So I start preparing them for labor, 34, weeks. And I just kind of gently do some points. But as they get to term, 37, 38 weeks, I definitely get more in there. it's a process. Our bodies, the cervix, all it knows is hold the baby in the whole pregnancy. And now it's a process to really unwind her. So I would encourage people, our acupuncture community, to practice side lying by layout points. So I'd say find the one that you can get to. So it's always an angle thing. I feel with my hands, and I always say, excuse me, I'm up in your grill too much, let me know. But you're really going in there. Oftentimes I'm going to have better luck with 31, 32 than the ones further down. But it is definitely doable. And I would just say find the ones that you can find. That's it. And I would typically do 2 at least. And, depending on where they're at, it's like if they're 38 weeks, you might just gently put 2 in. But if they're 41 plus 5 and they're going to be induced tomorrow, I might ease them, so it just depends on the situation.
Right.
I hope I answered your question.
I think you did, yes. So that is, yeah, she says, yes, thank you.
Okay, great. Wonderful.
Well, Deb, thank you again so much for this presentation. We're getting comments of gratitude and appreciation for your time and your knowledge. This was very insightful for all of us, and it was so wonderful to hear about your personal experiences and sharing your stories with your mamas. So thank you so much for that. And thank you everyone for joining us. This presentation is being recorded, and we will upload it to our YouTube channel by tomorrow, or if not in 2 days. So you will be able to enjoy this presentation over and over and over again. And like Deb mentioned right here on our screen, you can contact her at pushsandiego.com and pushprofessionals.com. And feel free to send her your inquiries via email as well. Deb, this was wonderful. Thank you again for your time.
Thank you so much for having me. It's been fun.
Well, stay safe, everyone, and thank you again, and have a wonderful evening wherever you are.
All right, bye.
Bye, everyone.